graph it. And the graphing is what's going to help us determine whether it's effective, not effective, change, measuring change on the behavior. Okay. So for us, for behavior analysts, our graphs are our little babies. They're very important to us. This is what we use to determine just the next step. What we need to do. If our intervention is working, not working, was there a change, not a change, and then why or why not. So we use what we call visual inspection. And this just basically shows your results, right, of all your observational periods, and also the level of behavior before and after treatment. For example, on page 48, you can see why a graph is so important, because it's not just numbers. A lot of people will get significance and numbers, right? Okay. I can actually see if there's a change. So here it tells you this is the number of aggressive responses. This is the behavior, okay? And what this is telling us is that when a demand is placed on this person, look at the frequency of aggressive behaviors, of responses, okay? So if someone tells him to do something, the frequency of his aggressive behaviors is, at this level. When no demands are placed, so they don't ask him to do anything, they just, let him do whatever he wants. Look, 0. Then again, placing demand. Behavior increases. No demand decreases. What does this tell you? Here, see this. Yeah. Function of behavior is to escape demand. Okay? Okay, so that's your, all right. So that's why graphing is so important, because you can actually see it. Okay, you can see the behavior increase or decrease. All right. Components of your graph, you all know that. So you have your x and your y axis. Your time is going to be your x-axis, the horizontal line. That's the line that tells you whether it was days, whether it was months, whether it was certain sessions or trials. I'll show you the graph again so you can see. But that's your x. And then your y is the behavior. And that's going to show you the dimensions. So whether it was duration, frequency, intensity, latency, whatever it was, that your y is your behavior. Okay?
Has there ever been a behavior that only happens maybe once a year or something? What happens to
I haven't come across that, but then that's where you would have to look more into it. If it only happens once a year, I probably wouldn't. And if it was severe, well, how severe is it? Yeah. But yeah, you'd have to look more into it. the X, you see, days. This is your time. So this means that, you can see on day 1, he studied 1 hour. Day 2, he studied 0 hours. 3, 4, etc. Time goes on the X. Y is the behavior, so we're looking at the hours of studying. And the measurement, so they're measuring it in hours. So you can see, okay, 1 hour, 2, 3, 4, 5. Okay? And this is standard for all our graphs. So then you have your X and your Y. You must label your X and your Y because, so I know my X is time, but I need to know, what is it, days, months, right, hours? We need to know the time. And then labeling your Y-axis is important because so I'm looking at a behavior, but am I looking at frequency, duration, intensity, what is it? So you need to label it and make sure you label it. That way, when someone else sees it, they can identify what it is that what the graph is trying to say. Make sure you have your numbers, your data points, phase lines, and labels. This is important also, especially when, like this one, for example. Okay, so this is what we would call a phase line because it's showing you that prior to this phase line, and then these are the labels. So baseline. So before treatment was implemented, okay, this was the number of hours that this person studied in 7 days, the first week. You have your phase line, now you know something new is happening. A behavioral contract has been implemented. Okay, so treatment has begun. Now you can see that because of this treatment, look, hours of studying have increased. Yes.
Would it be better if you're putting the baseline, behavioral contract, and after?
Oh, yeah. That's something we would call like a maintenance. You would take a maintenance of it, and to see that after treatment, let's say you go in a month later, and then you would measure the behavior again to see. Yeah, you would. That's good. Okay. Okay. So once we collect our data, we graph all of that. There are different research designs that we can use to show whether our treatment was responsible for the change. So was it your treatment that actually changed the behavior? That's what we want to know. So we are going to be, you're going to have your independent variable, which is your treatment, right? That's what you're implementing. Okay, that's something that's going to add change to the person's environment. And then you have your dependent variable, which is your target behavior, because the change in that behavior is going to depend on what? The independent variable. Yeah. And then, of course, you do want to try to control for any confounding variables, which, that can be anything that you weren't planning on happening that day, but it did. So let's say, you're going to work on a kid and you're observing him, but the occupational therapist comes in and starts working with him. That's confounding data because she's already implementing something with him that it's not in his natural environment. So, And then I think this goes into, all right. Basically all this is saying, I know it's long, but all you need to know is that the purpose of a research design is to show that there is a functional relationship. Meaning, for example, the graph that I showed you, this one, with this graph, yes, I can say that I have shown a functional relationship. That when I can show that the number of aggressive responses is maintained by escape from demand. Because, look, when a demand is placed, it increases. I take away demand, it decreases. If you're able to turn a behavior on and off, you have shown a functional relationship. And you can clearly see, that you're turning it on and off. You place a demand, behavior goes up. You take away demand, behavior goes down. Place up, take it away, it goes down. Okay? Any questions so far? No? Okay, so how? First, target behavior changes only when the independent variable is manipulated. So, only when those demands were removed is that behavior going to decrease. And only when the demands are placed, the behavior is going to increase. Okay? And to show that there's a functional relationship, the process needs to be replicated more than once. So like that graph I showed you, it was, right? They placed demand, took them away. Placed demand, took them away. And consistently we saw that both times that they took them away, the behavior decreased, and both times that they implemented them, it increased. So if you can replicate it, then the more you can show that there is a functional relationship between the target behavior and the independent variable. Yes.
Is a functional relationship, you said, for example, if the child is only aggressive when a parent demands something of it, but if the teacher were to demand the same thing and the aggressiveness doesn't show, is still that a functional relationship?
It is if we're working in that setting. So if we're working at home with the parents, then yes. Like I said, the behavior doesn't it's going to happen where you're going to go to the home or, with the kids, because maybe at school he's fine, right? He doesn't have any behaviors. Yes, you would still say that is a functional relationship if it's dealt with the parents, because then that means to me that tells me that I need to work with the parents.
The example of the graph you gave, zero behavior with no demand behavior. Okay, is that an example of an ABAB?
ABAB.
Mm-hmm.
Yeah.
Okay.
Yes. Which I think that's the next one. Yeah. So next we're going to talk about. This is just a list, so we're going to go through each one. You don't have to write it down. And the first one is the AB design. Okay. AB design is the simplest of all the research designs that we're going to talk about. However, it is not a true research design because it does not show a functional relationship. All the AB design shows was a change. But it doesn't show that the change occurred because of your intervention or treatment. Okay? So an A-B design basically only has two phases. The first phase is the baseline, so they took their data, and then they implemented their treatment, and then that's it. So it's just baseline, treatment. And I mean that's basically it with an A-B design. So we never use A-B design. I mean I've never used A-B design. Okay.
So this will just
Because it's not showing a functional relationship. Yeah, it's just showing that. Well, it would be more, and this would actually be more for, let's say, cigarette smoking, right? So if you're trying to get someone to maybe reduce the number of cigarettes per day, or to just quit altogether, you wouldn't want to have them start smoking again and then implement your treatment and then have them stop. So again, it has to, you also have to think about whether it's ethical or not, right? I mean, that's a health hazard, so you wouldn't want to re-implement it and then take it away.
A-B design would be used for that.
Right. Because then it would be, well, yes, you're showing that there was a change, but you still cannot show a functional relationship. Does that make sense?
So this would work probably like phobias or something.
Yeah, because you don't want to give it back to them,
Right.
Exactly.
Can you give an example of how you would use, what kind of treatment would you give someone who wants to quit smoking? Like in their behavior modification? Do you give them
I can't, it depends, on why. Why is that person smoking? That depends. But there's different things. I mean, because I've never worked with them before, but just from what I've read, you could do certain things like a behavioral contract, which I think you might have a chapter at the end. I don't know if they have one on there. Writing up a behavioral contract, so basically, and actually there's a research design that will show it's a changing criterion. So let's say you have for 2 weeks, right, you'll set a number. They cannot smoke more than this much. And if they fall within that, then, I don't know, you could do maybe at the end of the week, they can get something or each day. You might want to do each day, right? Or even if it's per hour. It depends on how much they're smoking per day. I mean, if it's a high frequency, then you wouldn't want to reinforce them at the end of the week, because that's a long time that they have to wait, So, it might have to be hourly, or maybe it's every 30 minutes, or, you just have to, it all depends. There's not like a set, protocol to use if, okay, I want to quit smoking, this is what I should do. It just depends on the person. But yeah. But that would be something, I mean, it would vary. It would depend. Okay. For you to use an A-B design, all it's saying is that in any design, your baseline must be what we call, it must show steady state behavior. So it does need to be, lengthy. It needs to show enough, it needs to have enough data points. Let's see here. So for an A/B design, it said, okay, baseline must be fairly long, data must be quite stable, effect must be rapid, and there must be little or no overlap between baseline and treatment points. So something like, for example, this. You have, well, you know what, let me show you this one first. Okay, so this is pretty lengthy, the baseline, but is it stable? No, right? It's going up, it's going down, it's going up, it's going down, it's going up, it's going down, and then this is, let's say this is your treatment. Okay, it's going down, but you still cannot say that it was because of your treatment, because in baseline, it was already going down. So whatever was happening here, I mean, it's already going down. So you would not, the baseline is not showing steady state behavior. So that would not be a good, you would need to continue until you got your steady state behavior to say that that was your true, baseline data. Versus something like this, oh, I'm sorry, did you have a question?
Yes.
Huh?
Let's say a behavior is very dynamic, and that's the target behavior. What do you then go and set as a baseline? Like, does that ever occur, or there's always a moment where
You just need to be able to define the behavior. So even if it's, let's say like aggression, you're saying like if it's like aggression, but then there's just different things. Yeah.
it's never at a set time, it's just very sporadic and random?
Oh yes, I've had that. Yeah. And so that's why it is important, to ask questions. So even if they say, well, all the time, anytime, right? Sometimes it just happens, because I've had that. Then still kind of ask, well, for example, then like in the morning, during this, and then you'll get to an answer to where, okay, maybe, this time frame. So you'll go in and you'll observe. And it might happen to where you go in during that time and nothing. Okay, let me try the afternoon now and go in. So, you are going to have to go and see when the behavior occurs, so that way you can get enough data for your baseline. Okay, and so this is an example where it's pretty, steady. Okay, it's lengthy, so this would be a better baseline to use than this one, than the bottom. Okay, so it has to show steady state. And then down here you can see that there's a decrease. Okay. Okay, moving on. So the next one, they kind of mentioned it, the ABAB reversal design. This design shows functional relationship, because this is where, we're turning the behavior on and off. The example was the aggressive behaviors, with demands and no demands. That's an ABAB design. And it is one of the most powerful research designs to use, simply because, you're showing a functional relationship, right? The behavior is decreasing because of your intervention or increasing, right? Depending what the treatment plan is. But so with the reversal design, that's where you take your baseline, then you're going to implement your treatment, then you're going to remove your treatment. So when you remove it, should your behavior continue or should it go back to baseline? What do you think? Go back to baseline. Right? If you're going to show, if you want to show a functional relationship, yeah, it should go back to baseline if you take away your treatment.
Meaning they're improving. Meaning they're improving, not that the line is decreasing, the behavior is decreasing.
Just meaning actually that you're turning it on and off. So yeah, not necessarily. Well, yes, improving when you're in your treatment phase, right? So let's say, let's say with the demand, the demand example. So when demands are placed, it increases. So when you remove the demands, they decrease. And since they were able to do it multiple times, you can clearly say that, well, the function is escape from demand. Because they don't want to do it. Because when you don't place demands, they have zero behaviors.
Do lifespan developmentalists use the same design strategy for behaviors, turning on and off behaviors?
I'm not too sure. With like developmental for developmental?
Yeah, the reason I asked was actually because I was taking that, my professor had asked us set goals and then asked how are you going to turn on and off that behavior, but I never got to ask him what he meant by that, and he was telling me in this class turn on and off.
Maybe what we call these designs, and something I do want to add, these are single subject designs, meaning it's on one person, right? We don't take data on multiple people and graph all of their behaviors in one. It's one person. Okay? And that's something that makes us a little bit different from, clinical, where it's more of a group, right? Group data. We don't do that.
So, again, I just want to remind so then every treatment, they're all different. There's not like a set curriculum,
Right,
at all that you can kind of do.
Right. But we have, and that's why research is so important, and data is so important, because that is what makes us unique. So because we rely on, let's say, they had this kid, and it was for an escape behavior, and they tried this application, and then there were several studies that used that same application with, let's say, escape behaviors. Then you can say, okay, well, you can try that on your kiddo. But only if the function is the same. Yeah. But yeah, it's not like, so throwing tantrums and he does this, okay, then you need to do this. There's no, written book that we can follow. Okay? Okay, so things to consider, and I kind of touched up on that. With the reversal design, so yes, you're showing a functional relationship, but if you're going to use this type of design, is it ethical? Do I want to turn self-injurious behavior on and off? Would you want to? No. So that wouldn't be ethical. So no, I'm not going to use an ADA design, on that. I gave the example of, smoking. They've already reduced the number of cigarettes. You don't want to turn that back on and have them, start increasing. So that you have to determine when you're trying to figure out, what design you're going to use. And then also, can the level of behavior be reversed? So if you were working on increasing social skills, so having the kid being able to go up to others and play with them and socialize and talk to them, so you've already taught them how to do that, you've increased that behavior. Can you decrease that behavior? No. You've already taught them something. How can you take that away? Right? You can't take it away. They've learned it already. So then reversal design you wouldn't use. This would not be the appropriate design to use to show that type of data. Okay? the last one, can I remove treatment after it has been implemented? So obviously, if it's something that's already working and helping them, and especially if it's going to cause any type of risk or harm, you wouldn't want to use this one. Okay. Okay. Next. Multiple baseline design. This just kind of outlines what we're going to, you don't have to write this down. We're going to go through each one. Yeah. Okay, so with multiple baseline design, there's 3 different types of designs that you can use, and that's either across subjects, across settings, or across behaviors, and we're going to go through each one. But when would you use a multiple baseline design? That's what you want to know. So if let's say you have more than one subject that, let's say you have 3 kiddos that all have aggressive behavior. And for each one, let's just say that, escape is the function. That's what you've concluded. So you have 3 subjects, all have, aggressive behavior with the same function, then you could use a multiple baseline design. Or, let's say you have a kid who is displaying aggressive behavior at home, at school, and, out in the community, let's say McDonald's or something, right? At a playground. So you could use multiple baselines across settings, because you're going to start taking data and you're going to use it after you start implementing your treatment to see, did the behavior decrease at all those 3 places. And I'm going to show you examples, that way you can visualize it. Yeah, and then so when an ABA-B design is not appropriate, you would use multiple baselines. So if it was unethical, let's say, right, to use that, then you could use a multiple baseline design.
So is this still just one person, or is this
It's still one person. Yeah, it's still one person. Even if it's across subjects, it's still I'll show you an example. Each subject will have their own, data. You're not going to mix them all up together. Yeah.
So you'd still be measuring each one of them?
Each one. Mm-hmm. Okay, so multiple baseline across subjects. This is on page 51. They have an example. So when you're using a multiple baseline across subjects, again, you're going to have your baseline and your treatment phase for each subject. So you're not going to take data and then put it all together and make one baseline. No, they're each going to have their own baseline. They're each going to have their own treatment. And they're each used as his or her own control. I mean, so you're not, like I said, you're not grouping anything together. They're all separate. Okay? If you're going to use a multiple baseline, this is what it's going to look like. This is across subjects. So, you're working on, for this one, they are trying to show when the nurses are wearing rubber gloves when they have contact with patients. So they want to increase that frequency of putting on gloves when they contact with the patient. So I guess maybe these nurses, were not putting their gloves on, every time they were touching the patient. So they wanted to increase that behavior. So you can see, okay, they have 4 different nurses. Each nurse has their own baseline. So they didn't combine them. They each have their own. With the multiple baseline, you can identify it with this staggered phase line. And this just means that each one, if you see the baseline is extended, so let's say, okay, this one, right, I don't know, let's say it's 14 days. Well, okay, this one's going to be 20 days. They're going to extend it for each one. Okay? And then here, intervention. So, after intervention, would you say that it caused a change in the behavior for all four? Yeah, it did. It did. Yeah, look, this thing, nurse 4, nurse 3, 2, 1, the behavior all increased. So it did, make a change. So this is one behavior that you're working on for all four, or for more than one subject, so you could use this type of a design. Okay? All right. So, honestly, it's the same thing, whether it's subjects or behaviors or settings. So with behaviors, as far as the graph is going to look similar. But with the behaviors now, this is one subject that has multiple behaviors that you're working on. And so you're going to, let's say you can't use a reversal design, so you're going to use a multiple baseline design to illustrate whether there was a change, whether your treatment, was functional with the change on the dependent variable. Okay? And that is going to look like this one. On page 52. So this is one subject that they were working on, and they wanted to increase 4 social behaviors for this one person. So it was, let's see what was it, rating of affect, seconds of eye contact, speech acknowledgement, and conversational questions, right? Would the person respond, did the person respond when someone came up to them and, made eye contact with them, asked them questions, all of that. So, again, here you see the staggered baseline across the 4 behaviors. The baseline is illustrated, and then you have your treatment. What, did it increase or decrease? And what can you see here? Was it effective or not?
Yes.
Yeah, across all 4 behaviors. Yeah. Okay. So do you see why our graphs are so important? Because you can tell. Now, what would happen if I saw that maybe on one behavior it didn't increase or decrease? I mean, then what?
You change your treatment.
Yeah, I'll need to look more into that, right, and figure out what's going on and why, what happens. Maybe I need to change up my treatment.
So what's the point of having it staggered as opposed to just one straight line?
Because you don't want it to, it kind of be like a, what's it called? Oh my gosh, I can't remember the word. Can't think of the word. So where you want to make sure that there was not any outside variables that caused, yes, thank you, a confounding variable. You want to make sure that it wasn't that caused the change. So let's say behavior 1 implemented the treatment. You want to make sure that treatment didn't confound with your data on this one, and so forth, which is why you're going to, let's say behavior 1, you start your treatment, but then I'm going to extend my baseline here to make sure I have my steady state, and then once I have steady state, then I'll start this one. You see that? Because then it will be kind of like a rippling effect, and how do you know that, well, when you started it on this behavior, it didn't confound with the second one. So that's what the staggered baseline is for. one kid, it's with at home and at school. So you're going to go to both places and you're going to take data. You would implement your treatment at both places. Okay? And then this one, you guys can look at it. It's on page 54. The examples of that. Any questions so far? Okay, two more. And then we're done. The next one, alternating treatment design. This is when you take your baseline, okay, and then for your treatment phase, you're going to use more than one treatment. And so you're just kind of going to see which treatment is more effective. So which one caused more of a change. Okay, and an example of this one would be on page 55, except they added. Okay. You should always do a baseline. But for example, on page 55 here, see, so it has they're measuring the frequency of aggressive behavior either when violent cartoons are shown. So when the kid saw violent cartoons, did his behavior increase or decrease? And versus no cartoons, when he didn't see any cartoons or no violent cartoons, did the behavior increase or decrease? So you have more than one treatment, and this is just illustrating. Well, when he saw violent cartoons, did his behavior increase or decrease? Increase, right? So that's all the alternating treatment design is showing. And it's also known as a multi-element design. So be familiar with that. And that's all. Oh, and they do occur in rapid succession. That way we can see which one is more effective. So let's say you would do like 1 day violent cartoons, day 2 no violent cartoons, day 3 violent, one after another. Okay. And then we have changing. Oh, that you have to worry about. Don't worry about this one. Changing criterion design. This one, with changing criterion design, this is what I would probably use if we're looking at maybe decreasing the amount of alcohol consumption, weight loss, cigarette smoking, what else? Maybe the amount of gum they chew, I don't know. Whatever it is you're trying to, decrease or increase, you could use the changing criterion. What this means is that you're going to take your baseline. Let me show you a picture. You'll take your baseline, and then you'll have different treatment phases. So let's say I'm trying to decrease the number of cigarettes that this person smokes per day. Let's say they smoke 20 a day. So I take my baseline, right? And then for phase 1, you're going to set a criterion. So let's say for the next 2 weeks, you can only smoke 18, right? So you'll take data for 2 weeks, and until they meet that criterion of 2, it doesn't matter if maybe it takes them a month, however long it takes them to where they're smoking less than 18, once they've met that criterion, then you're going to move on to the next phase. And now let's say it's 15 or less. And then again, right, another week or 2 with 15 or less, they've completed it, then you're going to move on again. And slowly start decreasing until you get to your target, which Maybe he just wants to smoke 1 to 5. Maybe he doesn't want to quit completely, but he just wants to decrease. Then that's okay. And so this is an example to show you an example of a changing criterion design. So here you have, here's your baseline, and this is total caffeine intake. And they're measuring, I'm guessing milligrams. Yeah. So this is how much they're intaking, okay, before. And so treatment phase 1. This little black line here, that's the criterion. So they have to have 900 or less milligrams of caffeine a day. Once they meet that, so here consistently, it has to be stable. So you can't have something that's like dramatically increasing and decreasing. It has to be stable, which it is. All right. Now we can move down, which 800, right? And then 7, and then 6, until you're seeing that they're way below the last phase. And then, of course, you would want to do a follow-up. Let's say a month later, you're going to check in and take data again to make sure that they're staying below their, whatever their goal was. Okay? So, yeah. So, you must make sure before you change them to the next criterion that you have